In The Brain's Way of Healing, Norman Doidge takes us further into the revolutionary world of neuroplasticity, this time focusing on the brain's astonishing ability not just to adapt, but to heal itself from a variety of conditions once thought untreatable. Where his earlier work revealed that the brain can change, this book unfolds the stories of real people who have used that change to overcome pain, illness, and disability. It's a journey into the brain's hidden healing powers that offers hope where medicine often seemed powerless. Doidge begins with the story of a woman named Barbara Arrowsmith Young, who suffered from severe learning disabilities as a child. Doctors told her she had a defective brain. But Barbara refused to accept that. Instead, she developed a program of intense brain exercises targeting her weak cognitive areas. Through persistent, daily mental workouts, she retrained her brain circuits, dramatically improving her abilities. Her story is a powerful testament to how purposeful brain training can repair even deep-rooted cognitive issues. For readers, this means that improvement is possible with commitment and the right kind of stimulation. The narrative then shifts to people suffering from chronic pain, especially phantom limb pain, where Doidge reintroduces the groundbreaking work involving the mirror box therapy. This technique, seemingly simple yet profoundly effective, tricks the brain into seeing the missing limb and allows it to reorganize the way it processes pain signals. It's a striking example of how pain is not just a physical sensation but a product of the brain's interpretation, which can be rewired to bring relief. This encourages readers to think differently about pain, viewing it as something brain plasticity can alter. Next, Doidge explores the healing of neurological disorders like Parkinson's disease through innovative therapies that activate brain plasticity. One striking case involves patients using light, sound, and movement therapies designed to stimulate specific brain areas and promote new neural connections. These methods complement traditional medicine and often yield results when pharmaceuticals fall short. The lesson here is that healing may come from harnessing the brain's natural rhythms and encouraging its regenerative powers through non-invasive, sensory-based interventions. The book delves deeply into mindfulness and meditation as tools for brain healing. Doidge describes how long-term meditation changes the brain's structure, increasing thickness in regions involved with attention and emotional regulation. These physical brain changes correspond with improved mental health, reduced anxiety, and greater resilience to stress. Readers are invited to see mindfulness not just as a spiritual practice but as a scientifically validated form of brain therapy. Doidge also discusses traumatic brain injury and the potential for recovery even years after damage. He recounts stories of patients who regain lost functions through tailored sensory and cognitive exercises that stimulate neural growth and connection. This challenges the old medical dogma that brain injury recovery plateaus after a certain period. Instead, the brain's healing potential persists, provided the right conditions and effort are applied. This serves as a call to patients and therapists alike to maintain hope and persistence. Another compelling chapter focuses on children with cerebral palsy, showing how intensive physical therapy combined with sensory stimulation can help rewire motor control areas in the brain. The progress these children make, sometimes exceeding expectations, highlights the brain's lifelong capacity to adapt and improve motor function. It emphasizes the importance of early, enriched, and sustained intervention for developmental disorders. The book also touches on stroke rehabilitation, showcasing how modern approaches use neuroplastic principles to coax the brain into rerouting around damaged tissue. Doidge presents innovative strategies like constraint-induced movement therapy, which forces the use of a weakened limb, stimulating brain plasticity and functional recovery. For anyone facing stroke or injury, this reveals the vital role of effortful, repetitive practice and the avoidance of learned non-use. Doidge introduces readers to a therapy called neurofeedback, where patients learn to control brain activity by watching real-time brainwave displays. This technique has been used successfully to treat ADHD, anxiety, and depression, offering a drug-free approach that teaches the brain to self-regulate. The takeaway here is that patients can become active participants in their brain healing by harnessing biofeedback technology. Throughout the book, Doidge stresses that healing isn't just about fixing damage but about changing the brain's patterns and habits. Addiction recovery, for example, involves creating new neural pathways that override old compulsions. This reframes addiction as a brain disorder amenable to neuroplastic change, and it encourages treatment methods that focus on rewiring rather than just suppressing symptoms. He also explores how music and rhythm therapy can facilitate brain healing, especially in cases of speech loss or motor impairment. These therapies engage brain networks involved in timing and coordination, helping to re-establish functions through alternative pathways. Readers learn that combining creativity with science can unlock remarkable recoveries. One of the most inspiring messages in the book is the brain's ability to heal through natural means rather than invasive procedures. Doidge champions non-invasive therapies that stimulate plasticity, such as light, sound, and touch, which harness the brain's inherent self-repair mechanisms. This shift toward holistic, brain-based healing offers a new frontier in medicine. The stories of healing are not just clinical anecdotes, they reflect a profound shift in how we view health and illness. The brain's plasticity means it can learn new patterns, discard old maladaptive ones, and even generate new cells under the right conditions. This science empowers individuals to take charge of their own healing journeys. Toward the conclusion, Doidge contemplates the broader societal implications of neuroplastic healing. He envisions healthcare systems integrating brain-based therapies widely, encouraging preventive brain care, and personalized treatments. This paradigm promises to revolutionize medicine, education, and rehabilitation by focusing on brain change as the foundation of recovery. By the final pages, readers are left with a renewed sense of possibility. The brain's ability to heal is not limited by age, severity of injury, or past failures. With persistence, appropriate stimulation, and openness to new therapies, profound recovery and growth are within reach. The book invites us all to become active agents of our own brain health, embracing a future where healing is defined not by limits but by potential. In essence, the brain's way of healing transforms the way we understand neurological illness and recovery. It is a hopeful, science-based testament that healing lies in the dynamic, ever-changing nature of the brain itself. The book leaves readers with practical inspiration to harness their brain's innate power to heal, improve, and transcend.